Thank you, Madam Chairwoman. Can I jump back, Dr. Downs? I want to touch on something that you were in a conversation you were engaging with Senator Schatz, FQHCs. Medicaid funding to FQHCs is in jeopardy. And if they don't get their funding, they could close their doors. And most people don't realize in Nevada, we have 28 federally recognized tribal communities. Not every one of my tribal communities has a health center. They just can't afford it. They just can't do it. So they rely on FQHCs. And sometimes those FQHCs are a 2-hour drive for them. So we're not just, a carve out, which we talked about, is not enough. It is really important that we provide a system of health care for our tribal communities, indigenous communities, that they can not only access, that's reliable, that's affordable, right? And so can you talk a little bit about these Medicaid cuts? It's not just the impact to tribal communities themselves, but surrounding communities where there's a system of healthcare that could be devastated, particularly in our rural communities. If you would touch on that.
Absolutely. And I think you brought up a very good point that it's just not the Medicaid, because if FQHCs or others are impacted, it also includes the retention and recruitment of staff, but then we have several FQHCs that are in high rural areas that they supplement housing for those providers. We have one island that access to it is on little 9-seater planes, and providers are coming in. Those things are all going to be impacted. So then it goes, where do our community go? Off island, where we already have health deserts. I mean, not the same way as I think South Dakota, but similar. Mm-hmm. Yeah, we have a water between the islands, but when pregnant women can't give birth on their islands, well, how does that? And so we already now are eliminating another access point.
That's right.
That's a challenge. The one thing that we recognize is the network. So I think oftentimes FQHCs and other health entities are siloed. Right? We do what we do in our community, and that's it. And we have recognized that we no longer can do that, that resources go down, that we're going to need each other and to support and pool our resources so we can continue to serve our community. But when those keep getting pinged off, it's really hard to keep doing that. And then our communities grow. And our providers don't grow, right? There's still only a handful, but the number that's coming grows. So I think it's all of these domino effects when we start taking off, and it might seem very minimal that we're going to adjust or take off of Medicaid on things, but then we might not see it today or tomorrow, but we're going to see it as people start having to close, and not even, close doors, but close services. Maybe they're not doing the 5 types of services, maybe it's only 2. And that becomes a problem. And for us, then we start looking at, if that service isn't provided on their island, where do they go? And do they have access to pay for a $200 ticket to fly to the next island?
Right. And it's the same. Listen, it's the same in rural communities as well. I know, listen, in Nevada, sometimes you have to drive 4 hours just to get access to healthcare. That's if you have a car and if you get off work to be able to access it. So it is a system that will shut down.
Yes.
That is essential for providing healthcare that, quite honestly, you've worked so hard to put together because of a lack of resources and a lack of providers and a lack of really geography that brings everybody together like you have in an urban area. So I appreciate this. I want to touch on, my time is running out. Mental health. I cannot stress this enough. I am so concerned about the cuts to mental health services that we fought for in our communities. There is a program called Native Connections, and I know about it because in my state, I have talked with so many of my Native community members. There's a 9-year-old girl in Nevada Urban Indians who was struggling with mental health, and she could not get the care from a school or a pediatrician, but it was Native Connections program that, according to her father, got his daughter back. It's a Native Connections program. And so I don't know if any of you are familiar with it or if you could talk about it, but please stress the importance of why funding for programs, particularly in this mental health and Native connections, is so important.
Okay, thank you. I'm so glad you brought that up. So it is clear to me that programs like Native Connections save lives, and thank you for that. And for my tribal community, last week, 2 suicide ideations happened with a 5th and 6th grader. These programs are so important right now to save lives, right? So suicide rates for Native youth are 4 times higher than any other racial or ethnic group. Native Connections allows awardees to tailor culturally appropriate programming to reduce suicide, substance use, and impact of trauma in tribal communities. Native Connections empowers Native youth by strengthening community ties and providing, as I said, culturally responsive support. Through this program, youth engage in models that promote through protective factors like personal wellness and positive self-image and a strong sense of cultural identity. Without this funding, intervention and support services for Native youth will become even more limited. This puts Native youth, many of whom experience discrimination, trauma, and loss of loved ones, at greater risk for resources available for them to heal. So I think it's so important. It's life-saving. So thank you for that question.
Thank you. Thank you, Madam Chairwoman.